Welcome back to video 12 of the EKG Detective. For this video, we will be looking at ventricular tachycardia as well as ventricular fibrillation. The EKG Detective is dedicated to helping people make the transition from using inductive logic to deductive logic. And if you'd like to learn a little bit more about the difference between the two, you can go back to video 1, where I spend some time talking about the differences between the two. Throughout this entire series, we are going to use two job aids. The first job aid is the EKG Detective Interpretation Checklist. The nice thing about this checklist is it really helps illustrate the mechanics of how deduction works. And if you're interested, just reach out to me at relevanceineducation.com and let me know that you would like a copy of the checklist, and I will make sure that I email one out to you so that you can use that as we go throughout this series. The second job aid that we are going to be using is the EKG Detective phone app. The app, unfortunately, is no longer available for Androids at the Google Play Store due to technical support issues, but it is still available at the Apple Store, and you can just keyword search EKG Detective, and that will take you to the page to be able to download a copy of the app. But you definitely don't need to have the app to be able to work through the process of deduction. So the biggest question to ask is who can benefit from using EKG Detective? And the answer to that is anybody who is struggling with an ECG interpretation. The nice thing about this process is it allows you to focus on the waveforms and the things that you can see in the ECG, and you don't have to spend as much time focusing on the criteria within an ECG. All normal rhythms originate from the sinoatrial node or the SA node. Ventricular rhythms originate within the ventricles, and those locations can be anywhere within a bundle branch or within the Purkinje network, but it will be outside of the SA node, and it's considered to be an ectopic rhythm. So as usual, the first question the app is going to ask us is whether the rhythm is regular or irregular. And ventricular tachycardias will always be regular. So we will go to the app, we will select regular, then we will hit next to go to the next screen. For those of us who are using the EKG Detective checklist, since the rhythm is regular, we'll be able to get rid of any rhythms that are irregular. And we can also get rid of ectopic beats because ectopic beats actually are beats that create irregularity, and since we have a regular rhythm, we can get rid of all of those rhythms from the checklist. The next question the app is going to be asking us is what the ventricular rate is. Ventricular tachycardias are going to beat at least anywhere from 100 beats per minute or greater. Typically, it's going to beat between 120 to 150 beats per minute. Our example that we're looking at is beating at about 170 beats. So we will go to the app, we will select 150 beats or greater, and then we'll hit next to go to the next screen. Since our rate is greater than 100 beats per minute, going to the checklist, we can eliminate all of the rhythms that are not 100 beats or greater. The next question the app is going to ask us is if there are P waves. Since we're dealing with the ventricular rhythm, there's not going to be a P wave. The reason for this is the rhythm's not being created somewhere from the atria, and since they're not coming from the atria, the impulse will not travel through the AV junction and through the normal ventricular pathway. So ventricular rhythms will have no P waves. Since this is the case, we will go to the app, we will select no, and then we will hit next to go to the next screen. Referring to our checklist, since there are no P waves, we'll be able to eliminate all of the rhythms that are associated with P waves and end up with these two options based off of this question. The next question that the app is going to ask us is what the width of the QRS complex is. And since we're dealing with a ventricular rhythm and we're outside of the normal bundle branch system as well as the Purkinje system, impulses are going to travel significantly slower than if those impulses came down through the AV junction and actually worked their way through the bundle branches and Purkinje's. And what ultimately happens with the ventricular rhythm is the ventricles depolarize significantly slower than if we're going through the ventricles. So as a result, when we go to measure the QRS width with the ventricular rhythm, they're going to measure wide and bizarre. And wide is considered to be 0.12 seconds or greater, and the bizarre appearance occurs as a byproduct of depolarizing via myocardial muscle tissue and not going through the bundle branch system. So with this, since we have wide and bizarre QRS complexes, or wide QRS complexes, we will go to the app, we will select 0.12 seconds or greater, and then hit next to go to the next screen. And upon answering that question, the app is going to take us to the rhythm that we've been dealing with from the beginning, which is ventricular tachycardia. Referring back to the checklist one last time, since the QRS complex is 0.12 seconds and greater and wide and bizarre, that means that we can eliminate junctional tachycardia, and the checklist takes us to the same place that the app did, which is we're dealing with the ventricular tachycardia that we've been dealing with. Moving on to ventricular fibrillation. Ventricular fibrillation is an abnormal rhythm where the ventricles just quiver due to chaotic and unorganized electrical activity. Patients will always present unconscious and in cardiac arrest with no pulse with this specific rhythm. Ventricular fibrillation is typically identified due to its chaotic and unorganized electrical activity. And there's not going to be any discernible waveforms just because of all of the chaos that's occurring in the electrical ventricular conduction system. It's typically broken down into a category of being coarse or fine. For coarse ventricular fibrillation, the way this is identified is you're going to look at the largest deflections within the waveform, and if the electrical deflections are greater than 2 big boxes or 10 millimeters in amplitude, that's going to be given a coarse designation. And for fine ventricular fibrillation, we're going to look for the biggest electrical deflections, and those are typically going to be less than 1 big box or 5 millimeters in amplitude. We aren't going to be using the EKG Detective system on these specific rhythms just because they're the only rhythms that present with lack of any discernible waveforms. All right, that brings us to the end of this episode. I just want to reiterate, if you would like to get a copy of the EKG Detective checklist, just reach out to me and I'll make sure that you get a copy of it. Also, if you have any questions about the EKG Detective phone app, you can reach out to me at relevanceineducation.com, and I would be more than happy to try to answer any questions or get you the resources that you need. And if you haven't done so, I would really appreciate if you would subscribe and like this video, because it definitely would help out as I'm trying to get this channel up and running. And I appreciate you for sitting through this video, and just remember that it is always better to practice as a clinician rather than a technician. See you next month.